So today's topic is perfluorocarbon. These are also called as artificial oxygen carrying medias and artificial blood substitute. Why they call it artificial? Because they are not naturally found. They are synthesized in the or manufactured in particular industries. Okay, so they are similar to hydrocarbons except that they do not have hydrogen atoms. In place of hydrogen, they are having fluoride atoms. So there is no carbon hydrogen bond, there is carbon and fluoride bonds, and because of these CF bonds there are some different properties they are having. Okay, so what are the properties they are having? The PFCs are hydrophobic, lipophobic, colorless, odorless, non-flammable, non-toxic, chemically and biologically inert, with low viscosity and high density. They are non-polar. That means they do not have any positive or negative charge. Okay, so what are the route of administration? We can give PFCs as IV route, as emulsions, and these emulsions are made up of tiny PFC droplets with the size of 0.1 to 0.2 micron in diameter, and they are evenly spread out in the buffered isotonic aqueous solution like blood and water. Okay, so what are the medical applications of PFCs? Medical applications, like we can use them in the liquid ventilation, in the ultrasound contrast imaging and cancer therapy, and the role of PFC are also researched in the gas embolism, right? So what are the property which makes PFC useful for gas embolism treatment? Right, so there are two properties: oxygen dissolving property and oxygen delivering property, right? So what is oxygen dissolving? PFC have high solubility for the gases which are non-polar, because PFC itself is a non-polar agent, so it attracts non-polar gases and dissolve them into it. These gases are oxygen, CO2, nitrogen and nitric oxide. This property, because they dissolve these gases, this property allow them to dissolve these gases and also to remove these gases from the blood circulations. Okay, and the property, other property is oxygen delivery property. So PFC can cause shrinkage of the size of the gas bubble and help in reducing the obstruction, because once it shrink the gas bubble, the blood flow beyond the gas bubble or beyond the embolus, so it will perfuse the organ. Okay, and other thing is PFC can carry oxygen which may help maintain tissue oxygenation, right? And despite presence of air emboli, so it improve oxygenation also. So PFC carries oxygen. Okay, and there become a diffusion gradient, means there is high concentration of oxygen in PFC and there is low concentration in tissue. So because of diffusion gradient, the oxygen will flow towards the tissue and CO2 will coming out from the tissue to the PFC. Okay, so it can oxygenate, it helps in oxygenation of the tissues also. Okay, so because blood carries oxygen, so these are similar agent like blood, that's why they are called as artificial blood substitute. So in the areas where there is sudden blood loss, we cannot have blood matching, cross matching, blood grouping, in like in military areas where there is extreme blood loss, then immediately if we need oxygen carrying substrate, then we use PFC in that area. Okay, so what are the advantages of using PFC? Hypoxia related condition we can use them, like ARDS, trauma. In cancer therapy we can use them. For cerebral ischemia, stroke and heart attack, the researchers has already shown that PFCs are useful, right? So these are nano size PFCs, nano size, and allow them to pass through the tiniest capillary, and it also reduce the size of gas bubble, so it will cause enhanced delivery of oxygen, improve tissue perfusion, reduced oxygen damage, and it promotes also healing. Okay, right, it do not require blood typing or cross matching. Easy storage and transport. We can store PFCs more than 1 year and at the room temperature without the need for refrigeration. Okay, then PFC can dissolve about 80 times more oxygen than the blood. It is very, very, very useful property of PFC. And in recent study, PFC can reduce the bubble clearance time by 36%, right? But apart from advantages, PFC may have some disadvantages, like it is very costly, and the gas, it may cause gas embolism, right? If the PFCs are not properly degassed or administered directly without degassing it, then it generate gas bubbles in the blood circulation. It will initiate the gas embolization process, and there may be obstruction to the tiny capillaries or blood vessel, and it will cause reduction in the organ perfusion or ischemia or damage to the organ. And PFC based therapy are being investigated in various forms nowadays. Okay, thank you so much, and please watch this video because you may get a question on perfluorocarbon, and there are very few videos on the YouTube on this topic, and you may get benefited by watching this video. Thank you so much.